Quick minute to talk about cannulas. Cannulas are a great thing to use in your practice, creates less tissue trauma when you're doing filler, and it can actually just be a lot easier to use. So it's really nice because Prolinium offers these easy guide cannulas where as you're learning cannulas, it's really nice when you put it in the little introducer. This stays in the skin and it's very easy to go right in through the port. I personally like to use the Dermasculpt, and they come with the introducer and the cannula. I only use a 25 gauge and a 22 gauge. So if you ever look up cannulas, you'll see that they go all the way as small as 30 gauge down to a 22 gauge. I recommend that you only stay at a 25 and a 22 because a 27 gauge and a 30 gauge can actually puncture a vessel. And one of the main reasons why we're using a cannula is to be safer and to lower a risk of a vascular occlusion. They've actually done studies that show if you use a 27 gauge cannula, it has the exact same risk as a needle. So if you're going to use cannulas, I would just go ahead and just order your 25s and 22s. If you come and train with us, that's what we'll teach you on. So I really love them to use for tear trough. I love it for temples. I even love it for the jawline. I feel like it's more comfortable for clients. The only thing is they feel a little bit of tugging, but as long as you pre-warn them about that, I just feel like it's much more comfortable. Love having patients feel comfortable, right? The last thing you want is for them to leave and just feel like that was like a traumatic experience they had. So on top of using cannulas, I also numb the port sites. So we have these cute little vials of Septicane. You can create an account with Darby Dental and you can order these. They're great because they're single use and it's actually 4% as opposed to 2 or 1% of lidocaine. So it's actually 4% Septicane and it does have some epinephrine in it. So you get some vessel constriction, so less bruising. So we can talk about that a little bit more if you have questions, but we love these. Got them during COVID when we couldn't find lidocaine anywhere else. So with the cannulas, what I like to do is when I'm measuring, I'm taking that cannula and I'm trying to figure out how far I need to get. And then I'm marking with a dry erase marker. We use this for marking for neurotoxin placement and definitely for where you're numbing for your cannula site. One, so that you can make sure that you're properly cleaning that cannula site, but also if you're numbing them, the last thing you want to do is put them through the pain of numbing and then you can't find where that little spot was that you put a little bit of lidocaine or a little bit of Septicane. I'll go through and draw on myself everywhere that I like to numb and then use the cannulas for so I can show that to you. Definitely such a great tool to use. If you're not comfortable with cannula, come and spend a couple hours with us. With a couple hours, I can teach you how to use it. It's a little bit tricky because the introducer holes are so tiny and then you have to be comfortable pushing through the skin, the fascia, the connective tissue and having a little bit of pop and putting some pressure in to get through the tissue and not being afraid of it. So that's really important. And once you do that, you get comfortable, you do it on a couple of models with me standing there, just encouraging you and letting you know that this is the right pressure, then it's super easy and such a nice way to give a really comfortable treatment and a really low risk of bruising. Doesn't mean you can guarantee no bruising, but definitely a lower risk. So I'm going to use this anytime I'm blending Versa or an HA filler and PRF. I'm going to use it almost exclusively when I'm doing tear trough filler, and then I'm just going to use it as an option for my smile lines and my jawline. Go over anything else that you want to know. It's pretty basic. 25 gauge, 22 gauge cannula, 1.5 inch to 2 inches. Anything longer than a 2 inch is going to really make a really flexible and soft cannula, and it makes it pretty difficult to work with. Okay, so I'm going to show you where I numb the port placement and what cannula I use on each area. So temples, I'm always going to use a cannula. It gets pretty tight up through here. You're popping through a lot of connective tissue. I just feel much more comfortable with a cannula versus a sharp needle. We do have your superficial temporalis artery there, so you want to be really careful, and I just love the cannula in this area. So I'm going to measure out when I'm doing my cannula. We're going to use the 22 gauge because I always blend PRF with Versa for temples. We can talk about that in another video. Treating temples is tricky. It takes a lot of product and you are going to love it if you blend PRF with an HA. I prefer versa. So I'm going to use a 2-inch 22 gauge, and I'm always going to measure how far I need to go. So when you're doing temple filler, you need to go to right about here. And so I'm going to start and I'm going to numb my port right about there. Up high on, you're actually on that lateral zygomatic bone, and then you're just going to place the filler all the way through here, and you're going to blend that. When we're doing tear trough, I'm only doing a 1.5 inch, and I'm doing a much smaller cannula, 25 gauge. You can use a 22 gauge, but you have to be very careful because the product goes out much quicker, and you only need a little bit of product in the tear troughs. So we're going to place this right about here, and then that's going to reach just perfectly up to the tear trough. You're also going to go underneath the malar fat pad, which is right through here, and you're going to be able to reach up and give a nice little drop laterally there. What's also nice is if you want to come across and place a little bit of filler right into the piriform aperture here, right in the PA, you can also access it here. And if you want to give a little drop into the cheek, you can go here. So when you put that port right here, you've got just nice access all the way around. Smile lines, usually I'm doing a little more superficial, but if I want to go a little bit deeper, someone has a really deep void, I will do a port right here. That's tricky because you don't have that much space to come up through here. So you just want to have your patient turn their head, hold the skin tight so that you have good control of your cannula. Let's talk about jawline. Jawline, of course, you have to be really careful about your facial artery, and we're really just working on doing filler on the gonial angle here. But occasionally, after I put some product right on the bone, then I will do a port right in this pre-jowl sulcus right here, and you can just take your thumb on someone's chin, your forefinger, give it a little bit of a squeeze, and you're going to see where their weakness is here. And then that way what you can do is you can give a little bit of a line going back and a little line going forward here. This must be the growth factor I have on my face. I am not able to draw anything. Normally you can draw just great. So you can use a cannula a little bit here, but just make sure you're not going just superficial on the jawline, because then if you do it only superficial and not deep, when they open their jaw, all the product will be right here on the skin, and that does not look good. So that's just a finesse on the top, but most of the treatment on the jawline is gonna go on the bone, right? So in review, you're primarily using it just for the temple and the tear trough, maybe a little bit for the cheek. Everything else is gonna go deep.